Hello, I'm Dr. Mark Dailey, and today we're going to wrap up our series on the thyroid and thyroid conditions. As I've mentioned before, I am a doctor of chiropractic that helps people overcome chronic conditions like yours, whether it's thyroid, hypothyroidism, Hashimoto's. We've had great success with those. I graduated from Life Chiropractic College in 1996, graduated from Functional Medicine University, and have advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and mastering the thyroid. Today we're talking about the 6 patterns of thyroid dysfunction. We covered the first 2 on our last video, which was primary hypothyroidism, which is the only one that responds to the medications most people are on, and then pituitary hypofunction. Now, number 3 in these 6 is thyroid underconversion. This is a common pattern associated with chronic adrenal stress and excess production of the adrenal hormone cortisol. You've probably heard a lot about that. Now, in this case, the body makes plenty of T4, but too much cortisol prevents the body from being able to convert enough of that T4 to the active T3. Another common cause for thyroid underconversion is the deterioration of the body's cell membrane in response to chronic infection or inflammation. Now, much of that can be revolved around gut issues. Now, cell membranes are in charge of multiple functions, including the conversion of T4 to T3. Chronic inflammation causes lipid peroxidation, in which harmful free radicals can damage the cell walls. Damaged cell walls hamper thyroid conversion. Now, in this case, we want to find the cause of the inflammation and improve antioxidant status. And that's the key to support in that case. These are things we look for in our office. Now, number 4 is thyroid overconversion. Well, you might think, well, if underconversion is bad, maybe overconversion is good. Well, it isn't. Elevated levels of testosterone in women create this pattern of too much T4 being converted to the active T3. And underproduction, this is probably a key, of the thyroid binding globulin. By now, I'm hoping you remember, thyroid binding globulin, or TBG, is the transport mechanism, actually a transport protein, that takes the T3 or the T4 to the conversion site. The excess T3 overwhelms the cells, so they develop a resistance to the thyroid hormone, and it can't get into the cell. As a result, the person with this particular disorder has all the symptoms of hypothyroidism, and these won't show up on your traditional lab test. Now, this pattern is most often found in women with insulin resistance and polycystic ovarian syndrome, because excess testosterone production accompanies these conditions. Now, in this pattern, reversing insulin resistance reverses hypothyroidism. The use of testosterone creams can lead to thyroid overconversion as well. Now, in this situation, the testosterone needs to be reduced and the liver cleared through a liver detoxification program, which again we do in our office. And then number 5 is thyroid binding globulin elevation. Okay, remember, thyroid binding globulin is TBG, which is the transport mechanism. TBG is what transports T4 to the conversion sites. This pattern is also associated with oral contraceptives or estrogen replacement therapy. So I think you can see how many things actually can affect thyroid production and thyroid, well, I guess thyroid function. Now, in people with this pattern, clearing the body of excess estrogen addresses hypothyroidism. Something else you need to look for. Now, thyroid resistance is number 6. This is another stress-related pattern in which the pituitary and the thyroid gland actually function normally and make the right amount of thyroid hormones. But the hormones are not getting into the cells to take effect. So again, you have the symptoms of hypothyroidism. Elevated levels of cortisol in response to chronic stress causes the cells to become resistant to thyroid hormones. In this case, managing the adrenal health is the ticket to addressing hypothyroidism. Another cause may include elevated homocysteine levels and a genetic predisposition to hypothyroidism. Now, it may sound complicated, but the truth is there are ways to restore normal function to the thyroid gland with the proper testing, lifestyle and dietary changes, along with the appropriate pharmaceutical grade supplements. Improved health and thyroid function can be obtained. Now, I want you to understand that your frustrations are warranted. And as I said earlier, as unfortunate as it is, modern medicine has failed the majority of people with a chronic condition, and hypothyroidism, or Hashimoto's, is no exception. My hope is that I have relieved some of your frustrations. And now you are starting to recognize that there are many reasons why you might suffer from all the symptoms of hypothyroidism yet have normal lab tests. No, you're not crazy. Or perhaps why you felt so much better when you started taking the medicine but slowly drifted back into all the symptoms of hypothyroidism. Now, in my office, we look for these and other reasons why you have the symptoms of hypothyroidism. And again, it is my desire to help add value to your life, help you achieve your goals, fulfill your purpose, and ultimately reach your destiny. Let me say before I conclude the series that if you are suffering from a chronic condition, whether it's your thyroid or something else, I'm going to offer you a free consultation in my office, which is normally a $275 value. We do have a waiting list, and I only accept a limited amount of new patients, so if you have an interest, call the office right away. It's either on this video or perhaps on the website. But I do want to thank you for following through with the series, for giving me your attention, for being interested in improving your health. Thank you. God bless you, and I wish you the very best of health.